I just feel like we live in this world today where we're like, what do we do? Because you see one account saying, don't do mammograms. And then you see accounts like mine where I'm like, do your mammograms. And so I want us to first just start off.
Breast cancer in the early 1900s was a death sentence, and the only treatment available was a radical mastectomy, which is a really barbaric surgery that luckily is no longer done. One sort of comparison is that a lifetime of mammograms between ages 40 and 80 or so is about equal to a standard CAT scan.
Wow. I hope that this right there is everything you need to hear of how important it is to get a mammogram.
The fact that they're advertising to fly to these different cities to have people who aren't radiologists, not in accredited breast imaging centers. It's not FDA approved for the detection of breast cancer. All of their FDA materials say this is only to be used as a supplement to annual mammograms. And the FDA has specifically put black box warnings out against thermogram centers. They've actually shut down centers for misrepresenting thermograms as something that can detect breast cancer.
And I think to myself, what if I wouldn't have done that? Are you confused about all the conflicting advice on mammograms? You've seen people on social media saying mammograms cause cancer. Do you wonder if radiation is dangerous? Or maybe you're questioning if mammograms even save lives. If you've ever had these doubts, this conversation is for you. Today, I'm sitting down with a radiologist who's going to be answering all these questions head on. She's going to be debunking myths, and she's going to make you feel confident with the decision that you make going forward. All right, now let's get to the show. Welcome to Not Today Cancer. I am so excited for this interview. A lot of you have been wanting me to get a doctor on so we can dive into the controversy of mammograms. We're going to set the record straight today, and I'm so excited. I have Dr. Marjan Bolouri in the house. She is a board-certified radiologist specializing in breast imaging. After completing her undergraduate degree at MIT, she obtained her medical degree from Baylor College of Medicine in Houston. She then did her 4-year radiology residency at University of California, San Francisco, followed by an additional year of fellowship training at UCSF in breast imaging and ultrasound. Since then, she has been working as a breast radiologist in a private practice in Denver, Colorado area for about 10 years. Dr. Bolouri is the woman behind at the Mammodoc. And of course, I'll have her Instagram account in the show notes because you must follow her. She shares incredible information there. But she helps people understand breast imaging. She breaks down the science behind breast cancer screening. Fantastic. So definitely somebody you want to follow. Thank you so much for being here.
Of course. Hi, Jen. Thank you so much for having me. I love the community that you've built here, and I'm a big fan. So thank you so much.
Thank you. And I know you're so busy, so to take time away, we really appreciate it. But I just feel like we live in this world today where we're like, what do we do? Because you see one account saying, don't do mammograms. And then you see accounts like mine where I'm like, do your mammograms. And so I want us to first just start off by breaking down this mammogram controversy.
Well, absolutely. First of all, I think it's great that we are in an age when women are taking control of their own health care, right? And they're realizing, it's no longer just the paternalistic, oh, just do this, relax, and you'll be fine. We are in the driver's seat. So when it comes to mammograms, I think it helps to kind of take a step back and look at how did we get here? And it really is because in the 20th century, people wanted to save women's lives. Breast cancer in the early 1900s was a death sentence.
Yeah.
And the only treatment available was a radical mastectomy, which is a really barbaric surgery that luckily is no longer done. But as women were living longer and longer, they were getting breast cancer. And doctors just wanted to find a way to prevent it as much as they possibly could. And they started taking x-rays. X-rays were invented in about 1895.
Wow.
And so they started taking x-rays of mastectomy specimens and saying, can we see these tumors? Is there some way we could have found this earlier? And sure enough, they started seeing, oh yeah, if we take an x-ray of a breast cancer, it shows up really well. And they just started extrapolating that to like, hey, let's when a woman comes in with a lump, let's do a new kind of x-ray called a mammogram and see the features. What can we see? And then over time, it just became such a good way of diagnosing breast cancer early that they started doing bigger trials involving thousands and thousands of women. And the early trials of screening mammography in the mid 20th century were such a success that it really just took off from there, because immediately you could see that women's lives were being saved.
Yeah.
So that's how we got here. And the technology has evolved such that, the radiation dose is lower, the resolution is higher. Now we have 3D mammography, which has really become the current gold standard. And I welcome, supplemental adjuncts to screening mammography. But just for your listeners to know, that's how mammograms came about. Nobody
Yeah.
was trying to come up with something to sell to women. It was
Right.
a genuine use of new technology to save lives.
Yeah. And just I don't know if you know my story, but it was a routine mammogram. In
Mm-hmm.
fact, it was weird. I kept seeing this number 1111 and I'm like, why? Like 6 months prior, I'm like, why? And it was right around 2020. Like, what am I missing? And I was like, wait, am I late on my mammogram? And I was just a little late, not too far off. But I went in and I felt nothing even
Mm-hmm.
after my mammogram. And they found the lump. I had no idea. I still couldn't feel it. And mine was stage 1 but grade 2. So it
Mm-hmm.
had more aggressive characteristics. And I think to myself, what if I wouldn't have done that?
Yeah,
You know,
Jen, you're the poster child for screening mammograms.
yes,
Your success story is why I do what I do every
yes,
day, and it gives me chills to hear your story because I'm that's you're the embodiment of women whose mammograms I'm reading every day,
yeah,
and you're right. It could have been months, it could have been years before you felt the lump, but stage 1, that's awesome. So.
yeah. I know. I'm so great. I'm so thankful that I went in, but I still have people that will question and say, "Oh, but I don't do mammograms anymore because of the radiation. How do you feel about it?" I'm like, "This is what saved my life. So I won't ever not go to my yearly mammogram. Like that is something so important to me." So how do we talk to people, or what do you suggest when people they fear it? Like how much radiation goes into our body, and there's a lot of other accounts that really scare women that they should not be getting mammograms because it actually causes cancer. What do you have to say about that?
Well, first of all, I think it's important not to lie to anybody. No one's trying to conceal anything. Yes, radiation is involved. And yes, there are risks to anything, any procedure, as you and Darren have discussed on your podcast
Yeah.
before. There's a risk to walking down the street. You could get hit
Right.
by a bus. So there's risks to anything. The dose from a mammogram is about zero point 0.5 millisieverts. That's the unit that we use to estimate the radiation dose that your body gets for anything.
Hmm.
So we have two kind of measurements for radiation, milligrays and millisieverts. The milligrays refer to the actual glandular dose that's going to the area being studied. And then the millisieverts is where we talk about the effective dose to your body. So 0.5 millisieverts is about where everyone agrees is how much radiation you get from mammogram. To put that into perspective, a CAT scan, a
Hmm.
CT scan,
Hmm.
is about anywhere between 5 to 20 millisieverts,
Oh, wow.
depending on the body part. Yes, so several times the radiation of a mammogram is how much radiation you're getting from a CAT scan. A CAT scan is, X-ray that goes around and around and around and is taking a three-dimensional picture of whatever body part's being imaged. So a mammogram is far, far less than that. One sort of comparison is that a lifetime of mammograms between ages 40 and 80 or so is about equal to a standard CAT scan, CT of the abdomen and pelvis.
Wow. I hope that this right there is everything you need to hear of how important it is to get a mammogram. That is
Right.
crazy.
And another comparison that we give people to put it into perspective is it's about the amount of radiation that your body is exposed to on a cross country flight,
Hmm.
whether a round trip flight, say, just to be generous. and the point of that comparison is not to say, no, of course, that radiation on that flight is not all going to the breast tissue, but it's just to tell you how little it is in the grand scheme of things. Nobody is, well, very few people, no one that I know is thinking about the increased radiation when they're flying. They're just thinking about what movie they're going to watch or what book they're going to
Yeah.
read or, what they're going to do at their destination. And so if you could take that small amount of radiation and harness it into 4 high definition pictures of your breast tissue that could save your life, wouldn't you do that?
Absolutely.
And I would. And I think, so that's what we talk about. Yes, there's a risk. No one's ever going to be able to precisely quantify that risk in terms of theoretical cancer cells caused by that amount of radiation. Most radiation experts have agreed that under 100 millisieverts of radiation, there's really no purposeful extrapolation of that data to quote unquote cancer harms.
Okay.
So I'm not telling people, oh, just don't worry about it. Sure, think about it, but make an informed decision about it for yourself.
Yeah. Well, I even for me, I am in the thought of I combine Western and Eastern. I do what the doctors tell me, and then I'm like, okay, what can I do? How can I take part? So there are ways too to detox, like heavy metals and radiation. And so there's certain protocols you can do to do that if that's something you want to do. But I would never skip my mammogram, ever.
Absolutely. And, something else that drives me personally crazy is women who skip their mammograms but still drink a considerable amount of alcohol.
Correct.
We know I'm no longer an alcohol drinker because for me the data is so glaringly obvious that there are no health benefits. There are only consequences. It significantly causes several types of cancer, including, unfortunately, breast cancer. So, I mean, if you're not gonna stop drinking alcohol, why would you forego a life-saving mammogram?
Hands down agree with you on that. So I do have a question on this. So somebody who gets a mammogram and it comes back as a category C or D, what if everything else is going well, they're healthy, there's no other issues? Do you think that at category C or D they should do it? I mean, I'm assuming at D they do, but should they do extra imaging like an MRI or an ultrasound?
So that's a great question you bring up. When you talk about C or D, just for people who aren't aware, you're talking about breast density. And we have 4 categories from A to D. C and D are both considered having dense tissue. C is heterogeneously dense and D is extremely dense. And what that refers to is how much white fibrous tissue we see on the mammogram compared to the black fat. So breast is just composed of normal fat, which shows up dark, and fibrous tissue, which shows up white. The problem is cancer also can show up as white on a mammogram, so having dense tissue can mask cancers. And so we're talking about women with dense mammograms. What can they do to increase the likelihood of detecting breast cancer? And fortunately, there are things to do. Supplemental screening such as ultrasound and MRI are what the FDA has approved as adjuncts for mammograms for women with dense tissue. For the most part, an MRI is reserved for women at high risk. So not just having dense tissue does increase your risk, but when we talk about high risk, we're talking about lifetime risk of getting breast cancer that's 20% or greater.
Okay.
Those women are categorized by American Cancer Society as high risk. And those are the women who should really be thinking about annual MRI screening on top of a mammogram, because MRI is the most sensitive test we have to find little breast cancers, especially tiny invasive cancers, before they cause a problem. MRI has downsides, mainly cost. You have to get an IV. You have to have contrast. So that's why it's not done in everybody, but it's reserved for those high-risk women. If you have dense tissue, but you're not in that high risk category, then that's when you should think about screening ultrasound
Yeah.
as your supplemental test once a year. So you should be getting the mammogram, but then also think about doing an ultrasound. And it doesn't matter how you time it. A lot of women like to stagger them so that each
Mhm.
is being done once a year. But you can do your mammogram and then 6 months later your ultrasound and then 6 months later your mammogram, etc. So every 6 months, someone's taking a look.
Yeah.
So that's what we recommend for those women with dense breast tissue who aren't high risk is a supplemental ultrasound.
Isn't there a test? I'm trying to rack my brain right now. Isn't there a test where everybody can, like a site where people can go to see their risk?
Yes. So you can just Google breast cancer risk calculator. I can
Okay.
send you the link that you can put in the show notes.
Oh yeah, do that.
Um, okay. So yes, and I absolutely recommend. First of all, everyone should do that by age 25 is kind of the recommendation. Get a handle on your breast cancer risk. Because screening has become so personalized these
Right.
days. And the important thing to know is your breast density and your lifetime breast cancer risk change over time.
Right.
There's so many factors that go into it. And Jen, one of the things we're seeing a lot these days is some significant weight loss due to GLP-1
Hmm.
inhibitors. And I'm seeing a lot of women whose density is going from that fatty, not dense to dense. And
Wow.
I want women to know, some of your listeners may be on those medications. Pay attention to your mammogram reports going forward and take note. If you go from, you may have always been not dense, but then all of a sudden now, because when you're on a medication like that, or anytime you're losing significant weight, um, it's mostly fat coming off of the breast tissue. And so the glandular tissue becomes a higher proportion of what we're seeing, and it can result in your density going up.
Yeah,
Um,
I'm thinner, and so I've pretty much always been dense. I'm C. I've been category C pretty much all along for a long time. But so is that typical for somebody who's just thinner? You have a higher.
uh, you really can't, you don't know. The only way to know for sure is a mammogram.
Yeah.
Um, in general, thinner people tend to have denser breasts, like really, really low BMI people, but it's not always the case.
Okay.
So
Got it.
so you really just have to pay attention to your mammogram. I'm like you, I'm a C. I used to be a D in my younger days, and now I'm a C. Um, yeah, so but pay attention to that because it can change with so many different factors over the span of your life.
Okay, I want to get into QT imaging and just other imaging options. Talk about that, but before we get there, I want to ask this question. So, since I had that diagnosis, I have a daughter. She's 25. So, should she be getting imaging sooner than 40, or should she just go through that assessment?
No, she needs to be at 25. We just recommend being aware of your breast exam. She should be doing a clinical or a self breast exam every month,
Hmm.
getting a clinical breast exam once a year, and she should calculate. Just go ahead and get a feel for what her lifetime breast cancer risk is at this age based
Yeah.
on her family history. Um, Generally, the societies recommend starting screening mammograms earlier in women with a family history, usually about 10 years before the age at which a first degree relative was diagnosed. So,
Okay.
how old were you when you were diagnosed?
47. So she would be 37.
Yeah,
So about
yeah.
37.
So,
Okay.
she should consider starting her mammograms at 37.
Got it. That makes
Mm-hmm.
sense. Okay, that's really good. Okay, so let's dive into the big hot topic of QT imaging that you see out there. And everybody's like, well, I'm doing QT imaging now instead of mammograms, so I don't have any radiation. Tell me about QT imaging and like, is it safe? Is it effective? What are you seeing with QT imaging?
Sure. So, QT imaging, I've done some research on it because when I started doing some outreach on Instagram, it quickly became apparent that a lot of people had questions about this. I had never heard of it until I joined Instagram. It's not a thing in my area. But through social media, people are hearing about it. Um, it appears to just be an effort to hone in on these these fears that some women have about mammograms, and say, here's something you can do as an alternative. It's based on old school ultrasound technique. So back in the day, in the mid 20th century, when ultrasound was first developed,
Hmm.
people realized you could just shoot sound waves through water and hit them off of objects and form kind of a little picture. And so the earliest ultrasound machines were actually people sitting in a bath of water, a tub, and these ultrasound probes would be around the tub. Um, we've evolved since then, and we learned, okay, we can actually just use ultrasound gel and get the probe right on the skin and get a nice higher quality image of tissues. Um, but this QT imaging was developed by someone who's not a radiologist based on that old school water bath technique. It's interesting. It's funny because I never thought I would see one of these in my career. When I learned about them and about the history of them from some older radiologists back during my training, but here we are. So that's the idea. They're just suspending a breast in a bath of water and shooting sound waves from outside that water bath to create an ultrasound image. Um, you could just have a screening ultrasound.
Okay.
Most facilities offer that,
Yeah.
and that's something that has been studied and proven to increase breast cancer detection, especially small invasive cancers in women with dense tissue. Unfortunately, this QT imaging just lacks data, and the fact that they're advertising to, fly to these different cities to have people who aren't radiologists, not in accredited breast imaging centers, charge you $600 to have this study, it just, from the get-go smells kind of suspicious.
Yeah.
And so I did some research. My followers know I've done a lot of digging into it. I'm really into evidence-based medicine, and
Hmm.
I like to really analyze the data. They have two little studies that they've published.
Hmm.
One was from 2020, and it was comparing QT imaging to 2D mammograms. Well, 2D mammograms are no longer the standard of care, but even so, QT imaging did slightly worse than mammograms at detecting cancer. It's a little better at detecting cysts, but we're not trying to detect cysts. We're trying to find
Right.
breast cancer. And again, this was a very small study, had about 100 cases. But again, based on 2D imaging, it's not really relevant to today. And then so they kind of redid a study. This was from 2023, comparing QT imaging to 3D mammograms. And all that they're willing to publish is that QT imaging was not worse than mammograms at finding lesions in the breast. Now, lesions is anything: cancer, fibroadenomas, benign fibrocystic change. So the researchers certainly knew how QT imaging did at finding breast cancer. And if it did better than a mammogram, you can bet they would have published that.
Oh,
Um,
yes.
but they didn't. And there are many flaws with the study. My followers know I've already been through this study with a fine-tooth comb with them. But one I'll point out to you is that there were only 66 cases of cancer in the patients that they studied. And out of those 66, only one was a DCIS, which, as you might know, DCIS, which is essentially stage 0 breast cancer,
Yeah.
that's what we want to be finding. It's super treatable. It's about 20 to 25% of the breast cancers, newly diagnosed breast cancers in the US. So to only include one DCIS in their data set is quite concerning because it's not a representative sample. And that was probably by design because we all know that mammograms are the best study for finding DCIS. DCIS, that ductal carcinoma in situ, presents usually as calcifications. And those show up very extremely well on a mammogram, no matter your density. Even if you're in the D category, we can see calcifications, no problem, on a mammogram. So it's just one thing I wanted to point out about their data to kind of show you how flawed these two very small studies are. And listen, I'm open to the possibility of someone coming up with a great screening tool for cancer that doesn't involve compression and doesn't involve radiation. I mean, I would be one of the people reading those if they existed. So I'll be looking forward to any further data that they come out with. But as it is right now, it's not, first of all, it's not FDA approved for the detection of breast cancer. All of their FDA materials say this is only to be used as a supplement to annual mammograms. Oh yeah. And they're not supposed to be marketing it as a substitute. And
interesting.
you know, it's
See, I didn't even look. Somebody brought it. I didn't even look at it because guess what? I would never do it. I just knew. Like I didn't even look at. I mean, thermography is another thing that people brought up to me, and I'm like, well, like I already know I'm going to be doing a mammogram, so and ultrasound if needed. And I don't love breast MRIs because it's really not fun and scary, and I hate it. But if I have to, and the doctor wants me to do it, I will do it because, like, literally, it's to save my life. You know, I don't
right.
think this is stuff you mess around with. And if one day, like you said, if one day the golden standard is something new that they've come out with, which has less radiation and not the compression, great. By all means, great. Well, that'll be but I know for me, I wouldn't do anything other than that, whatever that standard is. Hey friend, quick pause. If you're getting value out of this conversation today, don't forget to hit subscribe. Then you will never miss an episode, which a new one drops every single Saturday. And I would love to know, how have you felt about mammograms? Were you concerned about the safety of mammograms as well? I'd love to see your comment below. All right, now let's get back to the show. So what about thermography? That's another hot topic.
No pun intended. So thermograms have been around for a while, over 50 years, and that's just not even, it's just nonsense, to be quite honest. But just to give your listeners some background, the idea is a woman stands several feet away from this temperature, basically a thermometer camera. It makes an image of your breasts that looks like a weather map, basically. It's just measuring temperature differences on the skin. And I can tell you, as someone who's seen personally hundreds, if not thousands, of women with breast cancer, I mean, you're not going to get a significant temperature change on the skin surface unless you've got a really invasive, significant, big, superficial tumor. And at that point, it would have been, it's advanced. So there's never been any data to show that it detects breast cancer. So I even took the time to look at some of this data. It's not even worth talking about. It's so bad.
Yeah.
So no. And the FDA has specifically put black box warnings out against thermogram centers, saying, they've actually shut down centers for misrepresenting thermograms as something that can detect breast cancer. So the FDA is constantly putting out these warnings. Every few years, they do a new one because the old one, people forget about it, and they have to remind people no. And they send out letters to these thermogram centers, and none of these centers are run by MDs, mind you. It's all different people.
Yeah, I've even had, I remember this place where it was kind of like a therapeutic. They had like different like energy healing and all these things, and they would bring somebody in to do it there.
Well, here's the problem also is, what if with QT imaging or thermograms, what if they see something?
Right.
Then what? There's no such thing as a diagnostic thermogram or a diagnostic QT scan. They're going to just say, go straight to your closest legitimate breast imaging center, have a mammogram, and have a targeted ultrasound. So that's where we come in. And the problem for the patient is at that point, you're talking about a diagnostic study because you're coming in with a problem. Someone saw something on this weird scan, and you need diagnostic imaging, which, if you have a high deductible health plan, now you're talking about something that's subject to your deductible if you haven't met it already, and whatever copays you might have to pay. Whereas you could have just skipped that whole part and gone straight to a screening mammogram that's completely covered by insurance. So the patients are frustrated, and we all universally we see nothing. Usually the thermogram, luckily I don't see a ton of thermograms, but
Yeah.
the few that we have seen, it'll usually be, oh, we see some indeterminate hot spots in the superior portion of both breasts or the upper outer portion. And that's because you have less tissue there, and your core body, which is warmer, is showing through, and it's just a little bit warmer up here than it is down here. So it's always kind of the same thing. And the mammogram and ultrasound are not revealing. So
Good. I'm so glad everything you've shared, you've just made it so simple and clear. And I hope people are really listening. What about one last thing that I've heard people, and I don't even remember the name of it, but it's some like mobile ultrasound. And you pay like $250 and it's just like a mobile ultrasound. And I looked at it and I looked at the reviews and I saw a lot of negative reviews because there was a lot of miss like diagnoses, like you just said, like, okay, now I'm going into this diagnostic mammogram because or they've missed things. So have you heard about that? Do you know what I'm talking about?
I do know what you're talking about. We call it her scam.
Yes, that's what it is. Her
Well,
scan.
it's her scan, but we call it her scam.
Okay, I love it.
Yeah, it's another frustration of ours as, radiologists who work in accredited breast centers. The quality matters, especially when it comes to ultrasound. It's a technology that's pretty operator dependent, so you really
Okay.
need to be somewhere where they're doing dedicated breast imaging. You have dedicated breast sonographers, technologists who are accredited in this and know how to optimize the parameters to get the best ultrasound images of the breast tissue. There are a lot of factors that go into it, and unfortunately, some of the more franchise type places like you're describing just don't have the same level of quality.
Yeah.
So I would talk to your doctor about that before doing something outside of an actual breast imaging center.
And I think about it too. I think like, okay, if you do that, and that's what I saw most of it, it's either false positives or false negatives, and then you're so you're paying out of pocket for that. And then you're going through a whole thing and it's probably costing you more. And who knows if it's really trustworthy. I mean, listen, just go get your mammogram. Like, go do it the right way. I mean, just the whole thing on saying that lifetime radiation dose is lower than your lower than a CT scan. Like, that is bananas to me. So right there should be the hello, go get a mammogram. Don't do anything other than that. So this has been great.
Absolutely. I
Uh,
mean, are people thinking about how much background radiation they're being exposed to right now?
I know.
No, of course not. But a mammogram is about 2 months worth, or even less if you're like me and you live at elevation. It's maybe 1.5 months worth of background radiation. It's I just want people to know that they can put it in perspective, and in the grand scheme of things, the potential benefits really outweigh the cost.
Yeah. I mean, our phones, our Bluetooth, everything, all of that is radiation. And this could protect your life. And so that's why when I get asked about it, I'm like, I have to just speak on it because I think it's so important. And that's why I searched for you, because I was like, okay, I'm getting questions. I'm hearing all about this QT imaging. And I know the golden standard is the most important for me because it saved my life. And I'm just hoping that by us doing this together, we can help save somebody else's life who was contemplating not doing it. Because this is the difference between getting early and late stages breast cancer, and the difference in treatment and the difference of survival is very extreme.
Early detection is the best prevention
Yes.
for when it comes to breast cancer. The earlier we find it, the better you're going to do, the less invasive your treatment's going to be.
Yeah.
So, so why not?
Yeah. So I have I put this on my social media, like I said, and I have a bunch of questions and I kind of want to go through these. And we've talked about a lot. Like, this is interesting. Somebody said, is thermography and a CT scan enough to not have to get a mammogram? And now I'm thinking, like, well, with the CT scan, like, why would they do that? Maybe that was a mistake. Maybe she meant ultrasound.
Well, I have a feeling she meant QT scan.
Oh, maybe she did. Maybe she did. Okay, so we've already talked about that. And this one is a question that I don't know what this is. And I think maybe this person should go to their doctor if they're listening. But she said, is fibroadenoma safe to not biopsy? Can they really tell from the ultrasound? Do you know what that is?
A fibroadenoma is the most common solid benign mass
Okay.
that we see in the breast. And that woman should definitely talk to her doctor about her particular individual situation.
Yeah, that's what I thought too. We already answered that. Is it normal for the radiated breast to feel tender or inflamed 6 months after radiation? I mean, I can say yes from my experience. That's so normal.
Yes. Yeah, we know that radiation changes can occur for years
Yeah.
after you undergo radiation therapy. But definitely important to talk to your doctor about any new or concerning changes.
Yeah. I always want to say we are not giving medical advice. You need to go to your doctor for everything. I want to make sure we're very clear on that. But yes, I bet definitely just somebody listening, I went through it and your breast feels weird and wonky for a while. And especially if you have an implant, definitely feels weird, but definitely talk to your doctor if it's something concerning. We already talked about that. What age should women start getting mammograms? If there's family history, we did that. Oh, what if I have implants? Do I need a different type of mammogram? I think the 3D is enough.
Yeah, implants, standard mammogram is fine. We will do special views where we push the implant back, and so we can get nice views of your breast tissue in front of the implant.
Yeah. Okay, good. And then, in fact, they found my breast cancer and I had implants in at the time.
There you go.
So, and actually my doctor, I had such an amazing doctor, such an amazing radiologist. My breast surgeon said, I don't even see it here. Like, you are lucky. You have a really good
Wow.
radiologist looking at that, because it's incredible they found yours. So thank God. So what was another one? Oh, what about women who are pregnant or breastfeeding? Should they still be getting mammograms? Is it safe?
That's a great topic. So it's interesting, when mammograms first came around, it wasn't something that people had to think about because women were having babies in their 20s and women weren't getting breast cancer until their 50s. But those are both sort of coalescing now as women are delaying childbirth compared to before, and the incidence of breast cancer is getting younger and younger. And so now, if a woman needs a mammogram while she's pregnant, it is safe to do so because like we've discussed, the radiation is really just going to the breast tissue to get
Yeah.
that image. The dose to the uterus is so small to be negligible. Um, so it's up to the woman and her provider, but it is technically considered safe. Now, in breastfeeding, absolutely, there's no contraindication to getting a mammogram at any point during breastfeeding, and that is something that I'm a big advocate and proponent of, because there's a old school thinking that, oh, a lactating breast is too dense for a mammogram to see anything. But that's absolutely not true. And especially, as I've already discussed, calcifications we can see really well. And what we don't want to be missing is pregnancy associated breast cancer, which is any breast cancer that happens during pregnancy or up to 1 year after childbirth. Those tend to be more aggressive. So now we're in a place where we have women, getting pregnant and having babies into their 40s, which is overlapping with when we need to be screened for breast cancer. And the last thing I want is for a high risk woman who's working on building her family to go several years without a mammogram, that's not what we want. So yes, you still need to be screening, and please talk to your doctor about what regimen is best for you during that time.
Awesome. I'm so glad you cleared that up because I was like, I'm not sure about that. Why do you think women are getting younger and younger getting diagnosed?
That's the million dollar question right now. I think it's very multifactorial.
Mm-hmm.
People are thinking that it's likely a lot of environmental
Mm-hmm.
factors, some of which we may not even know about yet. Like you've talked about, there's a lot of radiation in the background that we're exposed to on the daily, um, and other lifestyle risks. Drinking, as we know, drinking among women went up during the pandemic.
Oh gosh.
And unfortunately, this is huge for alcohol companies. Women were kind of the last frontier of their untapped market. The alcohol companies kind of felt like they maxed out men drinking, and then women became the latest target. And so I think alcohol consumption among women, unfortunately, probably has something to do with it.
Oh yeah.
Um, and, just dietary
Mm-hmm.
factors,
Mm-hmm. Mm-hmm. I agree
probably,
with all
yeah,
that. Environmental factors, I think, and it's not one thing. It's a lot of things. I always say we have this rain barrel effect. People think, well, I've been doing it forever. I've been doing it for so long. I've been drinking every night. I'm fine. Like nothing's happened to me. But our bodies, we can only take so much. Our bodies are really smart. They can take care of a lot of things, but they reach a point where they cannot help anymore. And that's when, we get overloaded and the rain barrel just starts pouring over, and that's when disease is created within the body. But I think back to COVID, holy cow, and how much we had nothing to do but to have these drinks, and it was insane, and myself included. And that was a year before my diagnosis. And I think there was a combination of things. It's never to blame or shame anybody. When I
right.
look at okay, what could I have done differently? That empowers me. If some doctor were to tell me, oh, there's nothing you could have done, that would scare me because I would feel lack of control over that. Where I can make changes in a positive way, like my stress level, my mindset. I can calm down. I can slow down. I can look at the food that I'm putting into my body, because sadly, we live in this world of just overly ultra processed food that is just so unhealthy for us. And we don't know what that's doing to us and all the other things we just discussed. So I look at it as like, okay, I can make some changes going forward. And that helped me so much of minimizing the fear of recurrence because I made so many changes.
I think that's terrific, and I completely agree with you, Jen. It's so multifactorial,
Mm-hmm.
and some of these things we may never be able to have scientific data, because how can you do a randomized controlled trial about ultra processed foods these days? They're just
Right.
everywhere. Or things like stress and the inflammatory changes that it causes in our daily lives. But just each individual woman having that awareness about it and being able to make those changes for themselves, I think is terrific. And I completely agree with you. This is not about the blame game.
Mm-mm.
Breast cancer happens to all kinds of people, no matter what their lifestyle is. It's never anyone's fault. But we can all just take some steps to try to minimize the risk of getting it and the risks of what we do, and maximize the chances of finding it as early and as
Yeah.
treatable as possible.
And even risk other things, like when you're just living a healthier lifestyle, that might prevent cardiovascular disease and so many other things. People will say, well, this person was healthy. And I'm like, listen, I don't know if it's going to work, but I feel better, and I have less fear. And, so it's just, yeah, we do our best. Okay. Let me just go through a couple more questions and then we'll end it unless there's something else that I'm missing. Is an ultrasound enough if I don't want a mammogram?
No, because short answer is no. Mammograms find things that ultrasound can't. They're complementary imaging modalities, and especially when it comes to things like calcifications. And as I've said, that can often be the earliest sign of a non-invasive kind of breast cancer. That's what you want to be finding because it's really treatable.
Okay. And I think as I'm going through these questions, I think everything else we've basically answered. But somebody did say, will AI make mammograms more accurate in the future, or it's AI? Is there any big technology with AI coming up? You know,
I love this question, and yes, absolutely. We our Our big annual breast imaging society meeting is coming up actually next month in Colorado, and I can't wait because one day of the programming is going to be completely focused on AI.
wow.
Um, there are tons of applications for AI in healthcare, but interpreting mammograms is like a huge one where we're actually seeing really great data. In other countries, mammograms are read by two readers. In the US, in vast majority of places, it's just one radiologist reading the mammograms. I mean, there's such a shortage, but that AI component can sort of act as a second set of eyes on your mammogram.
Wow.
Yeah, so there are actually a lot of ways that AI is going to transform how we read mammograms. It's never going to replace a radiologist because at the end of the day, obviously, someone needs to be looking at the images with their expert eyes and have a name on the report. But I'm really excited about how it's going to transform things. So yes, that's actually a area of rapid uptake right now.
How exciting. I love AI. I'm like, ChatGPT is my best friend.
I know it's so useful for so many things.
It is. It is. Well, is there anything else that we missed that you can think of?
No, this has been a really great discussion. I'm so glad you gave me the chance to be on your podcast. I love this, everything that you've done here. This is such an awesome forum, and I just appreciate you so much for everything that you do, Jen.
Well, thank you so much. And thank you
Yeah.
for taking time out of your busy day because I know you're busy and being here and answering so many questions because I know you're going to change lives being on here because I know this is going to be a wake up call to people that were skipping mammograms. So thank you so much for being here. You guys check out the show notes. I will have all of her information in the show notes below. You're definitely going to want to follow her. She does have a good description of the old QT imaging. Like you can go through her reels. She does a really great explanation of all the questions that were basically answered today. And we'll obviously learn more about AI next month. So that's super exciting. So thank you for listening, and we will see you all soon.
Thank you.